Hey, Dr. C here. I get a lot of comments because we have general exercise programs trying to get the entire body, you might say, coordinated a little better and a little strengthening and all, balance. But people do have some disabilities and we can't totally ignore them. I tell people don't do the exercise if it's painful. But again, we want to tell people who have these disabilities, and there are a lot of people who do, we want to tell them what they can do, not what they can't do, because if they have pain, they're not going to do it. But if they can get some exercises in, they should do it. So I think today what we're going to do is to go through some of the major disabilities that people have and go through some of the exercises that people can do with the disabilities that they do have. Now, the major causes of disability as we get older are related to a number of things. It may just be aging. It may be an accident that people had, maybe a chronic illness that someone has. In other words, there's a variety of different things that can cause a specific disability in an area. Now, for example, the second highest disability diagnosis in the United States is back pain. Now, that back pain can be anywhere from the neck all the way down to the low back area. But back pain is one of the biggest disability reasons in the United States. So let's talk about what we can do with back pain. So let's start right up with neck pain. Generally, neck pain is not a very specific thing in the elderly because it can, again, arise from a number of different reasons. Fortunately, most of them can be helped, most of them. But remember, the back, the neck, now, there are several different components to that. It's not just a back, it's not just a neck. There are bones, 33 bones, vertebral bones. There are muscles, there are ligaments, there are pedicles that connect the body of the vertebra to the arch, which is where all the muscles are in the back. And there are facets. There's also a natural curve to the back. So all these things can be abnormalities, and some of them can be improved upon. So let's go through some of the exercises that we can do for the back. You can do them in different ways. You can do them in a chair, and we'll do a few in a chair. We'll do some standing. We'll do some on a mat, if you can get to a mat. But I always tell people, if you can't get to a mat, you're going to be in bed for some time. Let's face it, we all got to sleep. Just do them in bed. Most of the ones that we do on the mat, you can do these things in bed. That way you don't hurt yourself if you do collapse, you know? So let's go through some of the ones for the back in a chair. First of all, feet flat on the floor, hip width apart. Good posture, always good posture. Shoulders down, shoulder blades back, and looking straight ahead. Big breath in through your nose, out through your mouth. Now arms are going to come up. Stretch them up. Big breath in once you've stretched. And slowly out. Bend it over, breathing out. Breathing in, bring it back up. Breathing out as you go down. Breathing in as you come up. Breathing out as you come down. And back. Now remember, it's not just flexion, extension in the back. The back also goes side to side. We're going to do the quadratus lumborum stretch. Right arm up, over to the left. So you're stretching the quadratus on this side and pulling it in on this side. So you're exercising the left, stretching the right. Big breath in and out. And now left arm up. Stretch the one on the left. Big breath in and out. One more time. Right arm up. Big breath in. And slowly out. Left arm up. And out. Now we're going to do the twisting. That's the third different exercise for the back. Twisting, first the upper back. And remember too, you should do a stretch before you do any strengthening of these muscles. The greatest one I like for the upper back is the eagle, and we've done that a number of times. Arms out, right under left, at the elbow level, right hand now grabs the left and down. And you can feel that stretch in the upper back. Now, in order to strengthen that upper back, before you do it, you got to do that other side, left under right. Left grabs the right and down. And now some strengthening. What do we do for that? Touch the tips of your shoulders. Elbows are up. Bring the left leg up. Right arm touches the left. Stretching. Stretching. Right. Left. Right. And left. And you should try to do 10 of those. 10 of them total. Okay. Now what do we do for that low back stretch? Separate your feet a little further than the chair. Arms out. Bring that right arm, touch tips of the toes on the left. Other arm straight in the air. Back out. Left arm now goes to the right foot. Right arm stretches back. And back. Remember always to take that big breath once you touch. Right arm to the left foot, arm back. Big breath in. And out. And now left arm. Down to the right foot, right arm back. Big breath in. And out. Okay, so that's some of the stretching and things that we can do for the back. Now the back also has other components because as we get older, you get other things that happen to it. The bones themselves, if you happen to fall and land directly on your butt, you have what we call an axial pressure that's put on the vertebrae. That can cause a compression fracture of the vertebrae. What is the hallmark of a compression fracture? Pain, very specifically, just in that area. Now, if you get unlucky, you may put a little pressure on the nerves that come out from the spinal cord on the inside. They come out through little openings they call foramina. The one that is on the inside part of the vertebra, that is for the motor, for the muscle activity. The one in the back is for sensation. So that causes the pain, in other words. So you may, if, like I said, if you're unlucky, you may put, because of that compression now, you may actually cause pressure on the nerves. Then you get a sciatica type of pressure. So you get pain where that nerve goes. Might be to a leg, might be somewhere else. Depends on where you have that compression fracture. We also have discs. Those discs are like a little jelly donut in between the bones. And you can get drying up of that jelly. And so you get a narrowing now. That's why we lose height as we get older. We all get shorter. Or if you're unlucky again, you may get a little split on the outside of that jelly donut and the jelly leaks out. And that jelly can put pressure on a nerve. And that causes, again, pain shooting down that side of the body. So those are things that can happen as we age, unfortunately. The last component, basically, is that of the curves and the connections that you have in the vertebrae. And those are called facets. That's where they sit on each other. So there's facets in between each vertebra. You can get arthritis in those facets. And so in order to make a diagnosis, though, you need to have an MRI so you can really see well each facet. See if there's some arthritis in that area as well. Hallmark of that is pain in that specific area. Okay. So those are the things that you have for the back and some of the exercises that we can do. Now let's say that you also have muscles. We do. We all have muscles. Some of them are superficial on the surface and some of them are deeper. What do we do for the muscles? Because that's probably a little more common than some of the bone abnormalities that can cause pain. Well, what we can do for that are to try to strengthen, first stretch, then strengthen the muscles, especially the muscles in the low back area and around the pelvis. That includes the butts as well. Now, we had a whole program on the butts and what do you do to strengthen them and all. And so there'll be a couple of them I'm going to mention again this time for you. But we need to strengthen, after we stretch, the muscles in the back, the low back area. In order to do that, I'm going to get down on the mat because that makes it a lot easier. Now, you can do this in bed as well, like I said. So we're going to get onto the mat, and we're going to do what we call 4 points. 2 knees and 2 hands. 2 knees, 2 hands. 4 points. What do we do with those 4 points? Well, there's a couple of things. Number one, we can push that back out, touch the chin to the chest, and then pull it back in. Some people call this cat-cow. Out with the back, in with the back. I call it cat-dog because that's the way I learned it. Cat-dog, cat-cow. So out with the back, in with the back. So you're stretching and extending that back muscle as well. Now the next one is a more balance-oriented exercise. So what we're going to do is left leg goes out and right arm comes out. Now you tighten that buttock muscle and you tighten the belly muscle at the same time. Excellent exercise. Good strengthening exercise as well. Now when you get better at it, you can bend that knee and then grab the foot. Back out again. This is called a bird dog. Dog holds it, pointing to the prey. And then down. Now you got to do the other side. Right leg out. Left arm out. Bend the knee. Grab the foot. Back out again. And down. Now while you're in the 4 points, we can do a couple that will help the gluteal muscles. Remember the gluteal muscles? They extend the hip, abduct. In other words, out goes the hip, and then they help with rotation, inside and outside with the hip. So they not only give you stability, they give you also some strength to hold you in a nice steady position. What can we do to help the gluteal muscles? Well, first of all, we're going to keep that leg bent. Keep it at right angles if you can. Now you can either do a fire hydrant, out, out, out. Why do they call it the fire hydrant? Well, if you've got a dog, you know what they do to fire hydrants. And then you can also just lift that leg up. 2, 3. Or straighten it out. Lift. 2, 3. And then, of course, you can do the other side. I'm not going to do well, yeah, I think I can do the other side. I was afraid I was going to hit the chair there, but okay, fire hydrant. 2, 3. Out. 1, 2, 3. And down. So those are the 4-point exercises that we can do. There are other things that we can do as well. So let me stand. And let's do, I'm going to sit back down again. There we go. Okay. Let's go on to rotator cuff. That's the next one down the line from the back. The back is probably the most common, but rotator cuff problems are also quite common. You can get a strain. Oh, incidentally, what is a rotator cuff? What is that? Well, there are 4 muscles that join right in a little cuff, a little cartilage cuff around that ball joint. Remember, the head of the humerus, which is the upper arm, the head of it is a ball, and it fits into a little socket. So you get full rotation in there, full rotation. But 4 different muscles connect to that rotator cuff. You can get a tear of the muscle, partial. You can get a full tear. You can also get swelling. Now, if you swell from overactivity or whatever, you take up space. That swelling takes up space. And that minimizes the space between the bone, the humerus, the upper bone, and the scapula. It minimizes that space. That's called impingement. You may hear that term when you talk to an orthopedic doctor. Well, it's impinging. That's because the swollen muscle is taking up the space, minimizing the amount of space you have between those 2 bones. So when you move a certain way, it hurts. It hurts. So what do we do immediately for any joint pain? We use the basic treatment of rest, ice, and immobility. So you rest it. You rest it. Now, if you can, like if it's a smaller joint at all, you may use some compression on it. So they call that treatment basically RICE. You know, rest, ice, compression, and elevation if you can. So that's for about a week to 2 weeks. If that gets better, great. Then you can start strengthening that muscle again. If it doesn't get better, then they go through a whole series of different exercises that you can do acutely. And then once you get over that for a couple of weeks, then you go on to some strengthening. And basically that interval where you're doing those few exercises on the rotator cuff muscles, you're stretching them, gradually stretching them. And then you do the strengthening. Always comes down to that sequence. So what do we do for the arm? Well, that's basically what we do with our exercises. Remember, we touch on the top with our fingers, elbows straight out. You can just go down and up, 2, 3, 4, and 5. What else can we do? Well, stretch them out, 2, 3, 4, 5. What else? Well, bring them forward, 2, 3, 4, 5. And then circles. You may, if this hurts when you have that rotator cuff and it's not a full tear, then if this hurts, then you just do a pendulum. Just a pendulum. Moving it first in one direction and then in another direction. That's a very gentle pendulum exercise. Very important, though, to get that exercise because you don't want to get a frozen shoulder where you begin to get scar tissue in there. And then all of a sudden, you can't move it as far. So you just do that pendulum, start with a small circle, and then bigger circle. Bigger circle. So pendulum exercises are very gentle and one of the first things that you can do. Another thing you can do, arm across the chest, just moving it out, external rotation. External rotation. 3, 4, and 5. What else can you do? You can move it back. 1, 2, 3, 4, 5. I saw some physical therapists, they like to relate these to some motion that you may do. They call it a lawnmower start. So you start down by the knee, pull it back. Starting that lawnmower. This is basically, those are one of the earlier exercises as well. So that's 4 exercises right there that you can do for early rotator cuff tears or early impingement. And then you can go on to the strengthening exercises. To do the strengthening, you would do, let's say, weights or bands. That's what we use, weights or bands. And you want to exercise all 4 of those muscles. 1, biceps. Elbows in, and just gradually you increase the weight. So you may start with just 1 pound, 2 pound, go up to 3, go up to 5, may even want to go up to 10 if you can. So that's the biceps. Remember though, the triceps back here That's 80% of the circumference of the arm. 80%. Biceps is only 20 to 30%. So, you got to strengthen the triceps. What can you do to strengthen the triceps? Up. 2, 3, 4, 5. So that's helping the triceps muscle. What other muscle? Well, deltoid. That's the one on the side. 1, 2, 3, 4, 5. So that strengthens that particular muscle. So all of these are basically for the rotator cuff. You want to try to avoid, if you can, the injections that are done. Not that they're bad. Injections can help a lot. And they inject a steroid into that area. That takes the swelling down. They do that in other joints as well. But or they may have to do surgery. If you have impingement, they may have to do something to open up that area a little bit more. That's not a terribly favorable surgery though, so I wouldn't rush to get that done. Okay, so that's the shoulder. What else can we do now? Well, I've talked to you before about posture, and I've talked to you about jowls that you can get. Yes, the jowls, you remember those. And remember, there's also people who do facial physical therapy. And what do they do for that? Well, if you have jowls, they basically stretch and then strengthen. How do you stretch? Well, first of all, there's the O-ah. Now, what's the O-ah? Well, with an O, O, and ah. So O, ah, O, ah. Now the next one that they do, they move the edges of the mouth, move them up. Now, I don't know if you ever made a face in a mirror, you know, you move it up and down, up and down, up and down. So you move the edges of the mouth up and then back down. That muscle on the side here, that's the masseter muscle. That's a strong muscle. And boy, I found out when I was a resident and I was doing a scope inside someone's mouth, they were supposedly relaxed under anesthesia, and she bit down. Oh man, did that hurt. I had 2 fingers in there and I thought I was going to lose them. But boy, that masseter muscle is pretty damn strong. So you want to stretch it, and you may have to help a little bit sometimes. Moving it one side, stretching this, moving it the other side. Or you may just stretch it up. And up. And up. And then opposite, go down. 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 So these are all different ways to do and take care of the jowls that can happen in your face. Okay, I think we've used up our time. This is Dr. C. You have a good day.